love being a clinician. I love working with patients. I'm so grateful for the opportunity. There's so much that happens when you're in a room with a patient, you're listening to them and trying to figure out, working together, what's going to be the best treatment option for them. So I love bringing that to my class and really encouraging students to dig deep. Who's the patient? What have they tried before? What's going to be the best option for them? When I started designing my class, I spent a lot of time just mapping out what do I want learners to know and what do I think is really important for them to know in the cannabis industry. I worked with the instructional design team in the graduate school, which we're lucky enough to have. There are basically magicians, and I told them what types of objectives that I wanted, and I was able to work with the members on this team to really come up with some cool assignments that mirrored what students would be doing in practice. While designing my course, I spent a lot of time making sure that there was a component about evidence-based medicine. I really want to prepare students to be able to speak to all the evidence that is available behind cannabis and talk about the limitations of that evidence as well. And I had noticed that in some of the other classes, I was seeing students pull blog posts or random things off of Google. So I really wanted to help them learn how to critically evaluate the evidence. So I did very careful scaffolding where I teach students about each of the 5 steps of evidence-based medicine, and they build on each other throughout the different modules. So first, students start off learning how to assess a patient. Then they learn how to ask something called a PICO question, which helps them search the literature for relevant studies that are going to answer whatever type of problem that patient is having. Next, I teach them how to acquire relevant literature using scientific databases. I teach them how to appraise that literature and look for different types of bias, and then finally apply it to the patient. So as the students go through my course, these skills just build and build and build upon each other till the last module, where now they have to do everything completely independently without any of those, all the training wheels and scaffolding is gone, and they are able to come up with a really solid patient assessment and plan, and this mirrors what they would be doing in clinical practice.